before we talk about then specifically your approach to kind of round off the conversation, I would just say, just as a segue to move into the LGS
Yeah,
protocol, to touch on the Coimbra protocol and to understand a little bit of the difference between the two. Suffice to say, in terms of psoriasis, one of the papers I had found, I don't know if you know of Dr. Renu Matani, she's a Coimbra trained protocol
yeah,
doctor, had a case report. It was a series of 6 or 7 cases using the Coimbra approach. And the before and after photos of psoriasis patients were quite breathtaking. I will link that particular paper in the study. So when you approach Coimbra protocol versus LGS protocol, what are some of the core differences between the two? Because to my understanding, both of them are essentially the vitamin D regimen that I follow, but taken to the next level and done under the care and guidance of a physician, which leads me to the point that I was trying to make and wanting to kind of just posit the question to say that for the cluster headache sufferer that has either tried the regimen and found that they're one of the few that it doesn't work for, if they then went and kind of consulted someone like yourself and increased their vitamin D dosage to the point where they suppress their parathyroid hormone right down into
right.
the lowest point for normal reference, as well as adopting some of the I think you know where I'm going with it. I'll pass over
Yeah,
to you to
of
just.
course. Yeah, sure. Yeah. Well, there are some similarities and there are some major differences between the Coimbra protocol and the LGS protocol. The Coimbra protocol, as we know, focuses in elevating vitamin D to certain levels where we are able to inhibit the parathyroid hormone without causing, obviously, toxicity. And this is why we measure, serum calcium or ionized calcium, making sure that the patient is not getting toxic. Now, and I think the dosage that they say is 1,000 milligrams per kilogram. That's what they recommend. My dosage is halfway. And the reason why is because of this. These are my findings. Whenever I treat a patient who has an autoimmune condition, and I do use high doses of vitamin D, but not to the extent of Coimbra, is because I have found in my patients that when you modulate very well the microbiome, let me put it this way. Let's say that you are taking 100,000 international units of vitamin D a day, and your PTH is around 15, 18-ish, okay? Closer to the lower reference values. And you're taking 100,000 international units a day, okay? And I've known people that even take 200,000. But anyways, so the thing is that, okay, Coimbra protocol saturated those vitamin D receptors, and we know it's going to help those tight junctions. It's going to make beta defenses, catalycidins. It's going to start helping fight off the infection, and it gets better. And they also tell you, hey, you can't be drinking milk. You can't be consuming these foods because they're rich in calcium. And when you do that, we know that milk is pro-inflammatory, and we know that milk has casein. We know that milk has these things. So you're actually doing a little bit of anti-inflammation there too by taking out certain foods that are very rich in calcium, such as milk, right? So to a certain extent, that's good, right? But now what I've seen is that when you go over the full anti-inflammatory diet, okay, and you detect what herbs are great to be able to target those bad bugs that you have in your gut, all of a sudden, when you decrease that permeability, what I've seen is that, let's say if I was taking 100,000, now my PTH goes below the reference value. And why is this? And I'll tell you why, or at least what I think why, right? It's because I have reduced the endotoxemia to such a point that the excess endotoxemia that was there initially has been lifted off and now has allowed for the vitamin D converting genes to be able to make more metabolites more efficiently. And two, you're allowing now for those vitamin D receptors to be expressed more than before, allowing for vitamin D to do what it was meant to do. And this is why you get this big shift now in inhibition excessively of the parathyroid hormone. So then I say, whoa, okay, so that's too much now. And I don't need so much now. I can actually drop off the dose. and then bring it over there to the lower reference values. So that's what I did.
It seems like an oxymoron to think I can grab a pizza for lunch, but as long as I kind of got my vitamin D on this hand, then I might
I'm protected. Let's go. I got vitamin D on board.
And the same too, to reference again that paper with vitamin D versus gliadin, to say that why would you not kind of double up with a full approach, and the full approach in terms of what Pete Batchelor had come up with for the SUFRA, that tries the base regimens, so that being vitamin D, magnesium, fish oil, a couple of other cofactors, and it doesn't work.
Yes, of course.
Time to try the full Monty. And what does the full Monty look like? It looks like adding in a range of other cofactors, many of which you use as part of your protocol. So what does a comprehensive approach look like, and why? Just help me to understand why the likes of the other proponents of like a carnivore diet, and like Jordan Peterson, for example, I've never seen him talk about it. He's a smart gentleman. And in his conversations about carnivore diet, I've never heard him start talking about the importance or the value of using a GI map. So what kind of value do you place in taking a GI map, and how does that guide your decision making? So, yeah.
Yeah, sure. I mean, that's a very interesting question. And obviously, Jordan Peterson, he's very high. He's a very big proponent for the carnivore diet, and it does, in fact, help a lot of people, like I said before, but here's the thing. If you get a GI map of a person that's on carnivore, you might actually get improvements. And sometimes these people who are on carnivore diet, Craig, they do, slip in some fibers once in a bit. You can actually eat like avocados, and avocados are very rich in fiber and healthy fats as well. So you might be eating some veggies, very little, very to extent that it's mainly carnivore, but these fibers get in a little bit. That's one scenario. Another scenario, let's say you're going full 100% carnivore, nothing that has fiber at all. Well, if you do that, you're literally taking out the food source that's causing these bad bugs to grow. Okay. And then by doing that, you reduce the inflammation. And also, don't forget, you're taking out the lectins that are found in these plants that many of these individuals have certain sensitivity to these toxins that are found in certain plants that are very rich in lectins. So just the fact of taking out these lectins and just eating meat, for instance, and eating fat, for instance, you're just helping out improving, the symptoms. But that does not mean that necessarily you fix the problem. That does not mean that the microbiome is 100% in check. That just means at least that you've reduced the load of the problem. And then if you do a microbiome test, and I say this because I've done many microbiome tests, a lot of GI maps. If I were to win a commission on every single GI map that I've set, I would be a millionaire by now. But anyways, going back. So when I look at people who have been on the carnivore diet, I find salmonella. I find Escherichia coli, enterohemorrhagic. I find Clostridium. And then they say, well, you're on carnivore. How long have you been on carnivore? Oh, 1 year, Dr. Beltran. It's like, oh, good. And how have you feel? I feel great. No. And then I start looking at the diversity, and I know that there's a lack in the diversity. And this is, and then the reason I asked them, but then why are you consulting with me if everything's good? Oh, it's because I want to optimize my microbiome. And I saw your videos and I started to follow you. Anyway, so going back to the main stem of the story is that when people find out that there's a test that can actually look at your microbiome and that you can actually create a protocol or a treatment plan through a specific type of diet that can optimize the microbiome, that's the moment when you say, oh, I didn't know that I could improve my bifidobacteria, or I could improve my Akkermansia because it's absent, and I have patients that have had psoriasis and they have improved on the carnivore diet. And when I look at the GI map, there's no Akkermansia. You see? And if there's no Akkermansia, this means that this patient has taken away the lectin that was overcausing the inflammation, right? And has kind of improved the excess inflammation, but it's not perfected yet. There's still more you can do to make it better.